Hi everyone, welcome to Sawtooth Mountain Clinic's Oral Health Task Force's program of care for all in Cook County, Minnesota and the Grand Portage Reservation. Presenting today is Paul Nelson, the chair of Sawtooth Mountain Clinic's Oral Health Task Force.
Good afternoon. I've already the air conditioning always sits me. We don't have air conditioning, so. Anyhow, the chart that you see in front of you was actually a study that we've done with the Wilder Foundation on behalf of Health and Dental Foundation. We wanted to know what the highlights were for from the Oral Health Task Force on the effects of children as far as their health care and their school performance. What it really devolved around into was a history of how we do the things we do in rural Minnesota. And then it comes down to a prescription for how other counties could duplicate what we do. So, Wilder Oral Health Task Force and Health and Dental. So, who is the Oral Health Task Force? Well, we're a working group of the Sawtooth Mountain Clinic in Grand Marais, Minnesota. And we're a collaboration of non-medical, dental educators, and clinical civilian volunteers like myself. And our goal is to ensure that all children, all pregnant moms, all new moms, all seniors, all adults in Cook County and the Grand Portage Reservation have access to complete health care regardless of their ability to pay. And we'll find out who manage that. Why this work matters for all of us in rural Minnesota. Well, the oral health inequities exist in rural Minnesota, no kidding. We have limited access to dental professionals, they're few and far between. We have transportation challenges, which Cook County are enormous. We have higher rates of poverty. Our economy in Cook County is 80% tourists. And so all the young families living up there are working in the hospitality industry, which they pay very well. So you have both mom and dad have to work, and they both have to work 2 jobs. So that affects their ability to take care of the children. In fact, our median income in Cook County is $20,000 less than the state average. $20,000 for working poor families is a huge amount of money. And there's a lack of dental insurance. Well, that's statewide. So it's no secret that access to oral health care is linked to better oral health for children and adults. And it's a key factor in education, such as in school attendance and children's performance at school. They can't perform if they're in pain. And so we try to fix that. Here's Cook County. We're a truly rural county. 90% is federal or state land. And so we're scattered along the shore, around the county roads going up to the boundary waters. So in the Grand Marais in the center there, we have the Grand Marais Family Dentistry, Cook County Public Schools, Sawtooth Mountain Clinic, and Great Expectation School. Everything's clustered together. Way up on the right side, you've got the Grand Portage Reservation, which has the Oshkosh Charter School, Grand Portage Head Start, and Grand Portage Daycare Center. And way down on the bottom left is a cluster of towns, Lutzen, Schroeder, and Trofty, all kind of squished together. And we have the Birch Grove Community School, which is another charter school. Birch Grove Community School is interesting because even though it's in Cook County, kids from Lake County come up and go to school there because their parents have to live in Lake County. It's the only place they can afford to find housing. And then they come up and work at the resorts in Cook County. So what kind of barriers did we run into when we first started this operation? And this will sound familiar to a lot of you. In Cook County, we have economic vulnerability, which is poverty, lack of insurance, high cost for services, and inability to take time off. As I mentioned, when both parents are working 2 jobs, they can't just run off and do a lot of dental appointments. We are a very large county with 1 dental clinic, which means everybody's got to drive a long way. The folks up at the end of the Gunflint Trail have a 120-mile round trip to see the test. where I live on the west, and it's a 76 mile an hour. This is universal also. There's a lack of oral health education. And for kids and seniors, there's neither dental visits. And then there's always the big bill. Up at the Grand Portage reservations, health disparities exist, rooted in decades of underfunding for tribal health services. Workforce shortages, where everybody was, where the poor folks were jammed off into these remote spots to be the reservations. But the only thing to do there was to be a logger or a fish, they used to do. Fortunately, we now have a small casino up at Grand Portage, but it's not a wealthy casino, it's just small, and it provides jobs for people. Nobody gets big checks, but everybody can work and earn a decent living, as long as mom and dad both work. There are the intergenerational effects of medical mistrust. They have general mistrust of all white folks that will come onto the reservation and want to help them out. You know, help them out of their houses, help them out of their resources, help them. So there's generations of mistrust that you encounter when you first go to work with them. And there's a limited access, and this is very important, to culturally responsive care. We'll get into that. So how did the oral health task force come about and get towards that? Well, in 2012, the town dentist and I came together and agreed that we have a problem with the working poor families. And we knew that their kids weren't getting in to see the dentist because the parents couldn't afford it. But the question was, how do we reach them? How do we reach the parents and tell them that bring the kids in, they need help? And so we sent out outreach, caregiver outreach. We sent letters home. And of course, asking them to come on in, sign up, whatever. And we got virtually no response. So we figured that isn't going to work. Let's go to where the kids are. So we concentrated on the schools. And so we started going to our ISD 166 public school, and we set up a program where we scan every child in every grade and look for dental problems. And if we find a dental problem, then we report it to the parents and tell them there's financial assistance available if they need it. And I'll tell you some more about that later. Well, when we started, like the rest of the state, 50% of our kids had cavities, which is above the statewide average for kids that are untreated. By 2014, we had ISD 166 down to 26% cavity rate. In 2016, we went to county-wide screenings. We brought in the 3 charter schools, we brought in WIC, we brought in ECFE, and in 2018, we expanded to Grand Portage. We started with the Head Start and daycare, and what we found up there was an 86% cavity rate, which is not at all unusual for reservations. So our approach, it's a 3-legged stool. It's very simple. We refined it down to make it sustainable and workable. We do universal school-based screening. So every child in every school, in every daycare, in every WIC, and ECFE, every child is scanned for dental problems. And then we follow up. And this is the important part. If you don't follow up, things aren't going to happen. And so when we find a child who has a problem, we send a letter home, usually in the school folder, because parents look in the school folders. And we tell them that their child has a problem and needs to see the dentist. And if they have a financial problem, we'll help them. If we don't hear from them in a couple of weeks, they don't make an appointment at the dentist, then we call them. And at first this was difficult. Sometimes they had to call 2 or 3 times, but now it works pretty well. And you generally don't have to make a second call. We have the financial assistance available for eligible families at our local dental clinic. When we first started with this, we had a sliding fee scale based upon parents' income. But what we found out was that because we have all these working poor families, they all qualified for the top, and so we were paying 90% of the care, and they were paying 10%. So we just played it flat 10 and 90% now. That doesn't sound sustainable, but you can make it sustainable. tell you how. And then finally, the third leg of the stool, and probably, I think sometimes the most important, is community education and outreach. And so we've done a lot of education, and I'll explain some of that. But what we found was when we started with this with the kids in school, it was a traditional bell curve. We started off with everybody was restorative care. Everybody had to have cavities filled, all the kids. And so it was very expensive to begin with. So we had to go find all kinds of money to start off with. But as you clean the cavities out of children's mouths and you educate them on the importance of brushing and flossing, the bell curve comes down dramatically because the kids don't come back over and over and over again. And that really works. So it's more important to do prevention than to do restoration because you don't want the kids to be sick. You don't want the kids to have cavities in the first place. And the other thing is that with prevention, it's a lot less expensive and sustainable. So as the bell curve came down, the cost went down. Just before the COVID pandemic, we had reduced our budget by 60% in just 3 years, based upon getting the kids in, getting their teeth filled, educating them in the schools and when we see them, and 60% reduction, and that's sustainability. So what does the Sawtooth Mountain Clinic Oral Health Task Force look like? As I mentioned, we're a collaborative. On the right, you can see our partners. Cook County Public Health and Human Services. All these people are on our task force. So the supervisor of the Cook County Public Health and Human Services is on it. The director of the Grand Portage Health Service is on it. Grand Marais Family Dentistry, our town dentist, has the dentist, a hygienist who works part-time for us, part-time for the dentist, and is our educator, and a community health worker. They're all on our task force. For Minnesota Women, Infants, and Children, WIC, and ECFE, the public health nurse goes and sees them every 30 days and provides oral health education to the moms, new moms, and pregnant moms. And that public health nurse is on our task force. For the daycares, Head Start, and local schools, that's our hygienist educator. And she goes to all of those, educates moms, and does scans for the kids to find out if they need to see the dentist. Interestingly now, down towards the bottom, we've got the KINA group. And the KINA group, which is the Jig Wafer together, is part of the University of Minnesota Medical School. And the KINA group produces educational materials for children, comic books, and workbooks in their language and English. And so they started off with health education in Somali, in Hmong, and in Spanish. But it turns out the KINA groups at the University of Minnesota, and they're all Native Americans. And so they know about the problems up at the reservation. And so they wanted to do something in oral health, but they didn't have the technical expertise. So the Medica Foundation put them together with us. We created the content for books, and then KINA created booklets for pre-K through high school. We have 4 booklets. And we do the content, and they do the artwork and publishing. We're in our 4th publication now to keep this going, and then finally the volunteer residents. I have to mention, all of our partners, except the hygienist and our grant writer, are all volunteers. And so we're volunteer-based, and a bunch of people that are really enthused about doing this. Community education and outreach. And so that third stool that I said I think is the most important. So oral health education at Head Start and daycares. So in both Cook County and up at the Grand Portage Reservation, we provide oral health education. At the charter school and at Head Start up at the reservation, we put toothbrush stations and sanitizers in every classroom. So the kids brush their teeth twice a day in the classroom. So we know that they do it at least there. And then our hygienist goes up once a month to the reservation and teaches the kids in all the grades about oral health. She's got a 13-step curriculum that she's managed to work out to do this. So when we talk about hiring a hygienist, we want somebody who's enthusiastic about working with kids and is able to develop these kind of materials. We attend every school open house. We have a table, we have forms for the parents so they can see what services are available for them and the financial assistance is available. And we have toothbrushes and toothpaste and floss for the kids. You'll be amazed how these kids scramble to get those toothbrushes. We had one little boy who came up and took a toothbrush. He said, "Could I have some more?" And we said, "Sure, why?" And he said, "I have 6 brothers and sisters at home, and we have 1 toothbrush." We're here to start, so we're glad to be there. At all the events in Cook County and the reservation, we have a table there, where once again, we're there with materials and stuff for the kids. And I'm pleased to announce that our educator is invited up to the Grand Portage Health Fair every year, which is great to have the reservation come to us and say, "Would you please come help out?" Last year, she talked to 150 parents and kids at the health fair. We developed culturally responsive educational materials for the kids. And we moved on from taking care of the kids and the pregnant moms. And then we looked at who's next, who's the most needy about our community, and it was seniors. Our seniors up in Cook County are really in bad shape because they were all loggers and fishermen. That's all there was. So their social security checks are this big. And they depend upon our food shelves for getting by every month. I had one old man who came to me at an event I was speaking at. He said, "My wife and I have been retired for years and we're trying to get by on a social security check and a food shelf. But we never had money to go and see the dentist." He said, "Now we can." He said, "You changed our lives." And that's true. We do. So as far as those culturally responsive educational materials, here's 2 examples. On the left, you see Autumn's first visit to the dentist. These are the activity books that were created for the kids. And they're in Ojibwe and English. And they follow Autumn, the little girl, through her grades and into high school. And they're age appropriate for each of those groups. And so our educator created that material. And then the Gina group put the books together. And as I say, we're in our 4th printing of these things now. And by the way, if you go to the University of Minnesota Medical School Gina group, all of this stuff is available to download for free. All of the booklets. For a number of years now, we've been creating materials for expectant moms and new moms about how to take care of themselves in pregnancy and how to take care of the kids when they were born. And we translated them into Ojibwe. So now when you get the pamphlet, on one side you have expectant moms, dental hygiene in English, and then you flip it over. There it is in words I can't pronounce, in Ojibwe for the folks on the reservation. Goes a long way for the moms on this. One of the benefits of our approach reduces stigma. And this is really important because, first of all, the kids are cruel to each other. It used to be like, "You're going to go see the dentist, there's some kind of myth." Well, now, we go to the school, we take all the kids out of the classroom all at once, and then each one of them gets checked. No more stigma about going to see the dentist. And then we push them back in and we bring out another classroom before. Stigma for the adults. Adults that they haven't had money to pay for their dental care for years, they're embarrassed when we talk to them because they don't have teeth, or they've got a few teeth and they're not very good shape. And we take care of that, and they can feel like a human being again. There's an opportunity for health education in doing what we're doing. We address the economic barriers so that people can bring their children in. And that health education, where we send these booklets home with the kids, the parents want to see what they're bringing home, and so they read the books and they get educated. And it actually works. minimizes disruption. This is very important. It's important for the teachers in the schools because we want to come in and take the kids out of the classes, and they're already upset about kids being dragged out for this and that, and cutting into their education time. And so it took us 2 years to get into the public school system, to look, to scan the kids. Once we were in, and they realized how quickly we get it done more efficiently, and the benefits to the children, they're behind us all the way. We prioritize prevention, because as I said before, you don't want to have sick kids, and it's a lot less expensive than filling cabinets. And it familiarizes children with dental care. We have field trips to the dentist for all the daycares and Head Start. And bus brings the kids in, and they get to see what happens when they come to see the dentist. And so it's not a field trip, and it works very well. Well, what's the bottom line? Does this really pay off? All this work? Heck, no. Cavity reduction. In 2024-25 school year, just 10% of Cook County students, that includes the reservation, were screened had a cavity, down from 17% in 2015-16. As I mentioned, when we started in 2012-13, we were 50%. Now we're at 10%. And if you look at the chart way over to the right, which is the most common, you can see the combined number is about 10%. Public schools are improving every year because they have the least turnover of kids. And so these kids the moms they have the children there, they go through the entire process. They get into the schools, they get educated, they get scanned. Public schools are constantly improving. The charter schools have a harder time because we have a very transient population of young families who want to come up and work in glorious Grand Marais. And they last 3 or 4 years, and then they can't do it anymore. And leave, and it gets more in. And so in that year, there was a huge influx of new parents up onto the Denver Trail to work in the resorts. Fortunately, the public schools got most of the kids, so they're able to keep the average down. But the point is, year after year, we're reducing the cavities and the kids are holding that number down. So, what does this mean to you? Well, here's the essential ingredients for you to replicate what we're doing. Starting with the blue box, it's collaborative partnerships. That's the magic. And there's 2 things that are very important in that blue box. The first one, partner with a willing dentist, because I found when I started this thing that dentists didn't even want to talk to me. They thought I was going to bring in more Medicaid patients, and they were going to go out of business if they took all the Medicaid patients. Well, what they find is that our system of taking care of the kids and financing their care actually helps subsidize the Medicaid patients. And so our dentist takes everybody. She takes all the Medicaid patients. She takes, it works. It works for her. She's been able to increase the size of her clinic and take in more patients. And the bottom one about securing school buy-in early is very important because that's where you go to get the kids. And if the school doesn't cooperate, you're not going to get the kids. The other things about engaging health clinics and hospitals, that's important because they can funnel patients into the dentist when they find a problem with a child. And we've trained all the nurses in our healthcare clinic to do fluoride for all the kids. So every time they see a child on a wheelchair visit, boom. But then you need data sharing because you don't want to over-fluoridate kids. You want to make sure they have enough fluoride, but not over-fluoridate. So we share data about every time somebody fluoridates a child that goes into their chart. And so when the dentist sees it, they see that, oh yeah, the clinic gave them fluoride. No problem. Build proximity-based relationships. It's hard to get this thing going in the first place, so you want to have your local community. You don't want to be way out in the middle of nowhere trying to build partnerships. You want to be close together so that you can get together and brainstorm and talk about things that you need to do. We meet once a month and go over all the data from the previous month, and then everybody talks about what we can do to fix things. Define and focus your efforts. Clearly define the problem and scope. You're going to have to start small, and you really want to know what you're trying to do. Well, in our case, we defined the problem as working parents who couldn't afford to bring their kids in the dentist, and kids were not getting in to see the dentist. And so that's what we concentrated first. Then you prioritize those target populations and you keep your eye on the ball. We never forget that we gotta take care of the kids first. We're taking care of the seniors and we're taking care of disabled people. We bring up nurse anesthetists twice a year to take care of people who need an anesthesia to actually get their dental work done. It might be because they just throw it for their mouth, we had a flat palate, we needed extra help, we had disabled people who can't get their dental care. So we bring up nurse anesthetists twice a year to do that. Make it manageable. Use opt-out consent for screenings. When we send a letter home from the school backpack that says we're gonna be doing a screening next month for your kids. And if you don't want us to sign this and send it back, well, we get one or two back from parents who say, my kids are already seeing the dentist, thank you very much. Nobody else sends it back. Boom, we see the kids. And it's legal. Hire the right hygienist, and that's, without the right hygienist and a willing dentist, you'll never get the program off the ground. So you have to hire somebody who wants to help the kids. And you might possibly want to have a community health worker on the team too. We just hired a young woman from the Grand Portage band, and so we're giving her scholarships to go to dental assistant school and community health worker school. And she's already working part-time up at the reservation, at the reservation health service, and she's working part-time at the dentist office. And what she does is she does that follow-up. She does that calling the person home and saying, hey, I know you wanted to see the dentist. Well, if you come on in, we can help you pay for it and get it done. Start small and then scale. We started small, we scaled up. And by doing what we're doing with getting more and more prevention, we keep it affordable. Sustainability is key. You don't want to go through all this effort and get the thing started and then have it fizzle out. You want to have it sustainable, and to do that, you need to have local champions who are on your team. So you want to have people who will show up at every monthly meeting, who will try to do the work that needs to get done, who will bring you suggestions. And we found these people in our medical and dental staff that joined our clinic. Focus on efficiency and sustainability. We run an extremely efficient operation. Well, if we're taking care of all these kids and all these seniors and everything else, with one part-time dental assistant or dental hygienist and a community health worker, that's it. And then leverage storytelling and grant writing. Grants, the foundations love the stories that we talk about the little kids that come in or the old man that came in or whatever, because it proves it's working. And that's very meaningful to the foundations. So that's I'm done. Thank you for listening. If you have any questions or whatever in the future, you can contact me at my email address. And I think this entire presentation is going to be on the website, right? So you can come back and find out the information you need. Any questions?
I have a question about your opt-out consent.
Yeah.
So is that just for the screening, or what do you typically do when you first see?
Oh, that's for the screening.
Just
The screening is where we find out whether children have dental problems or not. Then we contact the parents and say, bring them into the dentist, and then it's working now. So they're doing it.
So you're not doing fluoride or anything like that at that time?
At the screening? No. Strictly a screening. And that way, by doing it that way, it's very efficient because you can see in our ISD 166, there's 400 kids that we do in a day and a half. So if you were going to do fluoride for every kid, we do those in wild child checkups. We do them at WIC, we do them in health fairs. We just every chance we get. And you can see what happens with our cavity rate. Kids don't have cavities. So the education works. Any other questions?
So sorry if I missed it. Are you doing the school-based screenings twice a year, once a year?
Just once a year.
Okay.
We'd like to do it twice a year, but what we found is that there's a tail to it, so you get the screening done, now you gotta get the parents to bring the kids in, and then the parents have it in, and all of a sudden you'd be ready to do the screening once a year.
Second question, does the nurse anesthetist go into the dental clinic, or is it in the hospital when they do
It's at the dental clinic, and, that's what they come to.
Okay.
By the way, I should mention that, up at the reservation, the Portage Reservation, we're putting in a dental office up there now too. We've already bought a portable x-ray unit that our dentist on her day off goes up there. And she sees patients and gives them complete checkups with x-rays. And so now we'll be working on a dental chair, which are enormously expensive. But we'll get that.
So you initially said that, I think, that you had resistance from the school?
Yes.
And so that, what did you do to resolve that?
Just went back and pleaded and begged and I didn't. You know, these are kids, we'll get it done quickly, and we promised not to interrupt, just give us a chance. And so that gave us a chance, and once we had a chance,
And then they were good after that?
they were great. Yeah, yeah, it's a matter of us calling up the principal now and saying, we'd like to come in on November 12th. Okay. It's done. Any other questions? Well, thank you for listening.